to do more to enable some of the relief that's already been put in place in smaller ways by the Trump administration.
What are some of the other things that the Trump administration has done to basically open the insurance market to more individuals?
Well, they've done a lot to increase choices, doing things that will lead to lower costs, both for individuals and hopefully down the road for more people, even if they aren't in those plans. One of the biggest steps they took recently was a new regulation that came out in the last couple weeks that allows employers to offer effectively defined contribution health plans rather than defined benefits, so people can buy the plan that makes sense for them rather than having their employer buy it for them. This is really going to help small businesses who may not be able to afford to offer the Obamacare plans that have such expensive premiums on the market today.
Marie, if there were one change, and I heard that you said Congress needs to be more involved, but if there were one change that you could just magically wave a wand and have in place in the next 30 days, what would it be?
It would be to shift the notion that there is one change that can solve all our problems.
All right, touche.
She just stabbed you.
Yeah, I got it. No, listen, I want the information.
No, I'm just kidding. But it's but again, that's how these Democrats are selling their idea of. They call it Medicare for all, but it's not Medicare for anybody. It gets rid of Medicare. It gets rid of private insurance in this country. But that is the messaging is, oh, dealing with the health insurance market is so difficult. Let me, Elizabeth Warren, take that on for you. I'll make decisions about your coverage, what health services you'll get, what health services you'll want. That's the messaging.
Right, and that's good messaging because in the sense that Americans are frustrated, and we're right to be frustrated with many aspects of our healthcare system. You know, costs are too high, we don't perceive we're getting value, and there is so much paperwork and red tape that we have to deal with, and it's frustrating to patients and it's frustrating to doctors. But the answer to that is not more of the same reasons that created our frustrations in the first place, which is misappropriate government regulation and financing of the system. We really need to peel away the layers of the onion, if you will, that have led to the mess we're in and end up with a place that really empowers patients and doctors to work directly together on the provision of their health care.
Well, wouldn't insurance companies have a problem with that?
Well, insurance companies do benefit from the current financing model that we have, but I think that at the end of the day, putting people in charge of their healthcare decisions will end up in it will end up in a more robust market where costs can come down and people can buy the right plans that work for them.
I wanted to ask you a quick question, if we can go back to that in the, I'm doing my TV anchor best in the teleprompter. Prescription drug prices are up 10.5% over the last 6 months. This is according to RX Savings Solutions, despite pressure from the Trump administration and Congress to lower these prices. What's going on here, Marie?
Well, I mean, so first thing is Congress and the administration is right to be looking at rising prescription drug costs, just like all rising healthcare costs. It is a major point of frustration for consumers, in part because we don't really know what's going on or why things are, the prices are moving around the way they are. But it's really important that policymakers who are taking a really hard look at this continue to try to figure out the root causes for why we ended up in this situation. And a lot of it has to do with misregulation after misregulation from the government applied onto a situation where the real signals of a market can get distorted. So the more that the policymakers can take a hard look at what's happening there, the more I think they can figure out how to get the incentives right to reverse the situation.
Marie Fishpaw, thanks so much for being here. Great to see you. Have a happy 4th.
You too.